Yeah, good afternoon. This is Dr. Yates, and just having a post-op visit with the patient, also a friend named Jeff. And we're kind of at the year mark, and we usually see our patients about 8 to 10 months, and then about at the year mark. And at the year mark, we kind of look at the hair, see if everybody's satisfied, meaning the patient and myself. And we look at the donor. We look and see what the donor would look like if the donor was shaved. We also look and see, can you do more procedures? Now, in Jeff's instance, his donor, let's see, Jeff, turn that way a little bit. His donor's excellent. We did about 1,800 grafts a year ago. And it looks untouched. I would say if I just looked at his donor with my loops, I'd say we could do easily 6,000 grafts throughout his donor with no one knowing the difference, and he could wear his hair buzzed down to a 1 without anyone staring at it. And that's a really good thing. Say, for instance, if he had a strip, and everyone who doesn't know what a strip is when you make the incision in the back of the head, you sew it up, and as the doctors say, it leaves a scar that looks like a line in your hand. But even if that's sewn up well and heals perfectly, if you wear your hair down to the scalp level, which for most people is about a 1.5, you're going to see that little smiley face. So I don't care, who says what. You're going to see the smiley face in the back. With the FUE procedure, Jeff had an ARTAS procedure. You can't see anything. Has anyone said anything about the back of your head? We can start there.
Not at all. Not at all.
Have you worn your hair pretty short before?
I have.
Okay, and no one said anything?
No.
Okay. So tell me this, has anyone said anything about the hair on the top of your head, like anything?
On a daily basis, I get compliments on how much younger I look and how full my hair is, and also that they can't believe that this is a hair transplant.
Wow. See, that's good what he said. They can't believe it's a hair transplant, because everyone in the past thinks of a hair transplant as the guy, like they'll say, I had a guy that had one of those. He lives across the street. When he cuts the grass, he has these plugs sticking out and this big cut in the back, and I know a guy like that. Well, the truth is, most people who've had a hair transplant, you don't know they've had a hair transplant. And people, not millions, but thousands of people do transplants every year and have results like Jeff. So now, what you don't know, Jeff is actually a stylist, a colorist, salon owner, so he's in the business. So it wasn't like we did a hair transplant on somebody that we could pull the wool over their eyes. So Jeff, you know good, you know great. What do you think of your transplant as far as how it's made you look?
I think it's excellent. I'm very pleased with the results. To me, my hairline looks natural. It does not look like plugs at all. I'm just elated with the results.
And this is someone in the business, so a lot of people, I've seen people on the street wearing wigs, and they think, and I ask them, well, how does your hair look, and I'll just ask them out of the blue, and they'll say, oh, it looks great, and they think that looks good. So, depending on where these things come from, it means something. So I want to show Jeff a picture to see if he knows this young fellow here. Let's see, let me show the camera first. That was a year ago, okay? So I want to show this to Jeff. Let's see, hold that. Who's that?
This is me 1 year ago.
That's 1 year ago. So the good thing about a hair transplant, it doesn't come in all at once. When did yours really start to grow where you believed me that was going to happen? Because everybody grows at different paces.
Probably at about the 4-month mark, it was very, very noticeable that everything was coming in.
4-month mark. Now some people I've noticed don't even start to really pick up growth to about 6 months, but usually by 10 months everybody has appreciable growth where they believe that yes, this is going to happen. And the thing he said, that it looks natural. Naturalness trumps everything. Trumps density, trumps whatever. Naturalness is everything. I want to show you this picture here. Let's see. Every person that we do a procedure on, after we place the grafts, we shoot a picture. And this is what we call like a judgment day picture, because it shows what their hair looks like when it's wet. It shows where we've placed the grafts, where we've emphasized. And like I said, our numbers here are approximately 1,800. We did some in the temples. But I'd say for that amount of grafts, that's a great result. Here's your, we call the judgment day picture there. You can see with your hair wet how thin it looks. And that's another testament, number one, that everything grew, it looks great. Jeff, what, and we've talked about this before, since you're in the business, you know about the strip, right?
Mm-hmm.
You know, now what were your thoughts on the strip? I mean, why didn't you have a strip, and why did you want to have the new, fancier, automated procedure with the ARTAS robotic system?
Well, the first reason was the pain, of course, involved with that. Also the healing time involved in being left with a permanent scar and the option to wear my hair short in the back.
I mean, that's the ARTAS ad right there. Everything he said, that he hit them on the head, and we don't, do we have cue cards, Jeff? Does anybody have cue cards? We don't even have cue cards. He hit them right on the head. The pain, the scar, no stitches, you know, it's microsurgery, it's less invasive. I was talking to a friend just earlier today that, and in a previous life I was a general surgeon and did a lot of work on the GI tract, and he was mentioning that he had an operation that was hardly nothing, you know, for a serious problem. And I was mentioning how he had to make big incisions, sew big organs together, and it was a big deal. It took 6 hours, and it was a big deal. But his procedure, as time has progressed, has gotten micro-invasive, less time, less pain, and works just as well. And this is the same thing that we have with the ARTAS. The long scar, just like a long incision, it's the same parallel. So every year medicine should get better, and it is getting better thanks to technological advances that both myself and Jeff have taken advantage of. So anything you just want to leave anybody with who's thinking about having a hair transplant, and you know, because it's kind of a secret world of hair transplants.
Mm-hmm.
People, every day I walk down the street, I see at least 200 guys that need a hair transplant, and somehow I have no idea why they're not getting one, because they're not fooling anybody. You know, they're not fooling anybody. Well, I mean, what do you think about that?
Well, I would say don't keep it a secret. I talk about it and make people aware, and make people aware what good work is and what it should look like, so then they're not afraid.
That's good.
Don't wait so long. I wish I would have done this 5 years ago.
Great. Well, I would agree. And I would say the same thing when I had my first hair transplant in my late 30s. I was kind of disappointed with myself because the results were so good that I waited so long and had all those years of feeling bad and sprays and hairstyles covering it up, you know, which the only person I was fooling was myself, because everybody else knew my hairline was about here except me. So, you've heard it. I think we've gone through everything, and great result. FUE technique here in Chicago. This is Dr. Yates with my good friend Jeff. Thank you.